All right. Welcome to lecture number 10 of Bioscience. Today I start with talking about the central nervous system, and then we will keep talking to the enzyme. That is the first part of the class. All right, so now let's start to talk about the central nervous system. The central nervous system are going to be basically on the center of your body. So what are the components of the central nervous system? We already reviewed in the previous class. We have an intro here that we have the nervous system is divided into the central nervous system and the peripheral nervous system. The central nervous system are going to be divided. Central nervous system is going to divide it into the brain, and the spinal cord. My dog found his paw delicious. I don't know what you find. All right, so brain. The brain is divided into the cerebrum, are going to be divided into the cerebellum, and we have the brainstem. Now, the brainstem are going to be subdivided into the midbrain, Masha, make me distract. Stop it, Masha. Midbrain. Then we have the pons, and we have the medulla oblongata. Okay, so the cerebrum are going to have many lobes. The frontal lobe, we have two frontal lobes. We have the occipital lobe. I'm going to put lobes here. And I'm going to cut here the peripheral nervous system. Okay, central nervous system. Occipital lobe, we have two lobes. We have the temporal lobe, two lobes, and we have the parietal lobe, two. Okay, so you know the frontal is a motor activity, occipital is vision, temporal is hearing, parietal is the sensorial area. Okay? Cerebellum is going to be balance and equilibrium, balance, coordination. Balance, equilibrium, coordination. And the brain stem. And the brain stem is going to be the midbrain, pons, and medulla oblongata. So all of these are going to be components of the vital signs and other components. Here is basically where it's going to start. It's going to begin here. The cranial nerves. Cranial nerves are in number of 12 cranial nerves. And basically all of them are going to be parasympathetic. All right, so just remember here, we have the central nervous system, we have the cerebrum, cerebellum, brainstem, and I want just to visualize that in your mind, because we are going to add one more structure that is called the diencephalon. I will tell you how is that. All right, so here we have the brainstem. The brainstem, please, I just want to remember this. This is like a flower. The flower is the cerebrum, the leaf on the side of the flower, and here we have a stem. This is the stem. Actually, the stem of the flower is the brainstem. Why I'm trying to give this comparison? Because I don't want you to confuse, and people confuse brainstem with the midbrain. Okay, brainstem. The brainstem is this. All this is the brainstem. All this is the brainstem, brainstem. We have here the midbrain. This is the midbrain here. Here's the pons. And here's the medulla. Es medulla oblongada. These, as I mentioned, are coming the cranial nerves. It's a parasympathetic nervous system. Okay? All right. All right, so the midbrain, for this, I need to just, to make it simple, and actually what we need to know is this. We have cranial nerves, the cranial nerves. Cranial nerves are calling because coming from the cranium, right, the cranial area. So from at that level. So we have 12 nerves. This is the midbrain. This piece is the midbrain. This is the pons and the medulla oblongata. So it's from here the majority of the cranial nerves are going to arise. For this, most likely, I need to talk to you about the cranial nerves that we need to know. Okay. Cranial nerve. Number 1 is in Roman numbers. The name of this cranial nerve number 1 is going to be called the olfactory nerve. Olfactory is an olfactory nerve, yes. Cranial nerve number 2 is going to be the optic nerve. Cranial nerve number 3 is the ocular motor nerve. Cranial nerve number 4 is the trochlea nerve. Cranial nerve number 5 is the trigeminal nerve. Cranial nerve number 6 is going to be the abducens. Cranial nerve number 7, the facial nerve. It's a lot of nerve. Cranial nerve number 8 is the vestibular cochlear nerve. Cranial nerve number 9 is the glossopharyngeal. Cranial nerve number 10 is the vagus nerve. Ocal, the pneumogastric nerve. Pneumogastric nerve. 11, cranial nerve 11 is the accessory. And the last one, cranial nerve number 12, is going to be who? The hypoglossum. All right, so yeah, okay, looks like it's a lot, right? So I'm not going to ask in the exam, so I want just to introduce to you the cranial nerves. These cranial nerves, when you go to the doctor, do you see the doctor, they asking you, open your mouth, look at my finger, follow my fingers, up and down. Do you notice that or no?
Yeah.
Yes.
Okay, all right. So here we have, those are, what are the result of that? I will tell you. So for example, they make you smell something, nostril by nostril, nose by nose, and you can tell the cranial nerve is okay. Optic nerve. Optic nerve is how many fingers you have. I show you. 4, 3, 5, 2, 1. So actually the optic nerve is okay. Ocular motor neuron, the trochlear, and the abducens are going to be three of these nerves that are going to be the ocular motor, the trochlear nerve, and the abducens nerve is what I call the nerve that is 3, 4, 6. 3, 4, 6. 3, 4, 6. So 3, 4, 6, what they're doing is eye movement. Eye movement. So, and the doctor is putting the finger like that and follow my finger, right and left, up and down, right? So that is 3, 4, 6. Trigeminal, what is going to do is the mastication. I'm going to do mastication. Mastication. So you're going to check, for example, close your mouth, try to open your mouth. You cannot, against pressure, right? Open your mouth, close your mouth. So you need to have, actually, this is your hand, this is the patient's jaw, mandible. They're going to check if the strength is okay. So that is the trigeminal nerve. Facial nerve is when you make frown your head or smile or close your eyes, open your eyes. So that is facial nerve. Vestibulocochlear nerve are going to be how to check the assessment of the hearing. Now, I want to ask you, how you can check the ear, the patient is hearing. The patient, when you are checking the hearing of the patient, it's very simple. I will show you. And don't forget that, because we are going to see that in anatomy physiology. In anatomy physiology, I'm going to ask you to tell me all the names of these cranial nerves and the functions. Okay? Now, Marcel, I want you to do this with your finger and do this. Put it close to your ear. Can you hear that? So that is how you check the hearing. Very fast. So, can you do that? Oh, yeah, there you are. So that is what you hear. You hear this? You hear that? Right? So the patient is telling you that if the hearing is okay. All right. Then we have number 9, the glossopharyngeal is swallowing. Can you swallow water? Swallow saliva. Vagus nerve, neurogastric nerve is when you open the mouth and you say and they put a stick and they put you on the back and make you like nauseous. So that is a good. The vagus nerve is doing okay. Accessory nerve is what I call the I don't care. So you ask the patient to shrug the shoulders, and you put a force here in your hand to check the strength of both sides. So they should be the same. And hypoglossum is the movement of the tongue. How you can check the strength of the tongue? Use your imagination. How you can check the strength of the tongue? I will tell you. Put your hand here in the cheek and push with your tongue inside. Now, up with the same hand, go to the other side. And as the patient do the same. On the cheek, right? On the cheek. So that is how you can check both sides are okay. All right. So all this explanation, what I'm going to ask, and don't get concerned about that, is one simple thing. The simple thing is this, that when you are doing this cranial nerves assessment, if all the cranial nerves are doing okay, it's like you are putting your eyes inside the body and looking the brainstem. So you're looking the brainstem with your bare eyes inside. And that means that the brainstem is normal. When is going to happen that? When you have, for example, a car accident, a whiplash that's coming from the car accident, they are going to basically have some contusion. What is contusion? Contusion is when you have a car accident, not only your bones and your muscles are moving inside the cranium too, and this is the bone, this is the brain is doing this. It's more compression because they have different densities. They move at different, when they are stopping all of a sudden, they move differently. And that can produce damage of the brain stem. So when you have a whiplash accident or you fall or you have multiple traumas, they're going to check by sure 100% the cranial nerves. Okay, conclusion and some summary here and some recap. Number one, where are located the cranial nerves? Everybody? Where are coming from the cranial nerves?
Central nervous system,
Okay, more specific.
midbrain,
The brain stem. Okay, the majority, except the olfactory, all of them are coming from the brain stem. Is that clear?
yes.
All right. So you smile, you chew it, you whatever you're doing. Actually, many things are going to be functions of the cranial nerves. Where are coming from? From the brain stem. Do I need you to remember which coming from the midbrain, pons, and medulla oblongata? The answer is no. I'm not going to ask that because it's not needed. Okay. All right. So now, number two, how many cranial nerves we have?
12.
12, right? 12 cranial nerves. 12 cranial nerves. And all these have different functions. And you're going to learn that. I'm telling you ahead of time, that is what you need to know for anatomy and physiology. In this class, what is just needed is, you can start memorizing that, is that where are coming from the cranial nerves, how many cranial nerves are, and what is this cranial nerve, sympathetic or parasympathetic? Those are origin as parasympathetic nervous system. I mentioned that. This is the third time I'm mentioning. So conclusion again, the recap for this slide. 12 cranial nerves coming from the brain stem and use a parasympathetic nervous system. ¿Me okay with that?
Yep.
Okay. All right, so here we have the brain stem. There is different components. If you see here, we have basically the upper cranial nerves. This is midbrain first, then the pons, and then the medulla oblongata. So please don't get confused here because let me see if I have a picture here. No. Oh, there you are. So here's the cranium. Up to here's the cranium. This is the cranium. So this is the cranium. This is your eyes here, your nose here, your jaw here, something like that, right? The other jaw here. And if you see here, this medulla oblongata is going to continue as the spinal cord. Spinal cord. This spinal cord is called medulla. Where is the medulla? From here, all the way down from here. At the moment they go out from the occipital bone, that is called the spinal cord or medulla. But this portion that we have here, that this part of the brainstem is called medulla, but more properly called medulla oblongata. So the medulla oblongata are going to continue as the spinal cord or medulla. This medulla oblongata means in Greek dilated, distended, enlarged, bigger. So if you see here, the medulla oblongata, this thickness is more thicker than here, correct? So the medulla oblongata is up to here. All this is the medulla oblongata. Medulla oblongata. How is it going to continue? Through the spinal cord or medulla. Is that clear or no, please?
Yes.
Okay.
Yeah.
So we have pons 4, 6, 7, 8. Pons 5, 6, 7, 8. because 2, 3, 4, the one starts on the, not all kernels start on the brainstem. Only one or two are going to start in different parts. But in general, what I want you to remember that most of the cranial nerves start in the brainstem. Okay, the pons is going to be 5, 6, 7, 8, and you can tell the medulla are going to be the lowest, right? 9, 10, 11, and 12 is the medulla oblongata. So here is the medulla oblongata is what I want you to know. What is medulla oblongata? Medulla oblongata is part of the brain stem. Okay, so we have superior, the midbrain, middle, we have the pons, and then below that we have the medulla oblongata. This medulla oblongata is very important to remember because that is mostly of the lesions that you have. Somebody have car accidents, etc. So falls, traumas, they are going to affect the medulla oblongata. The medulla oblongata, we was talking that the brainstem is part of the vital signs. So basically, all vital signs are coming from the brainstem. And the medulla oblongata is particularly very important because they have many two center control that are very important. Number one is the heart. So we have a cardiovascular function, cardiovascular. What means cardiovascular? Cardiovascular, the heart and the vessels, arteries and veins. These cardiovascular are going to control the heart rate, how fast is going to be your heart rate, right? So you're running or you're resting, you're stressed, etc., your heart rate go up. Your blood pressure as well, the blood pressure. So those are the main components of the cardiovascular. Where is located this center? In the medulla oblongata. Then we have another one that is the respiratory center. The respiratory center is going to control the respiratory rate. Are going to be other centers of cough and vomit reflex are going to be there as well. But I want you to remember respiratory and cardiovascular. If you know those two things, this vomit and cough, you will learn when we talk pharmacology, when we talk about anti-nauseous and antiemetics. So what is the main function of the medulla oblongata? Is to have the control, the center control for the cardiovascular respiratory centers. Okay with that?
Yep.
Marcelo, are you okay?
Yes.
Okay. So what we have in the medulla oblongata, the center for the breathing and for the heart. All right, so now, one important thing here about talking about the medulla oblongata, this is the brain stem, and above that we have the cerebrum, correct? This is the cerebrum. Above this is the cerebrum. Okay, so now, here, we already been talking about the afferent and the efferent, the sensory and the motor nerve. And let me see here. Okay, so what we have here is that, remember, we have the afferent, then go up to the brain and then go back, correct? Right? You okay with that? All right, so now, just a moment. Now, what really happening is this. You have here the brain, the cerebrum, and the cerebrum is going to send fibers in response of the peripheral activity. So we have here these nerves coming from one side. Let's make it from the left side, and this is from the right side. From the right side, these fibers connecting, as we talked in the previous class. But what happened in the medulla oblongata? In the medulla oblongata, what it's doing is this. They don't go all the way down in the same side. They're going to jump to the other side. They're going to just go from one side to another side. So go from the right to the left and from the left to the right. So that is called the decussation. Okay, the decussation. What is the decussation? Decussation is the crossover. Crossover. Nerves crossover. All right. So why is important about this? What is important? Somebody can tell me? Why it should be important to know that in the medulla oblongata we have a crossover? So from the right side, instead to go all the way down on the same side, they're going to cross to the other side. So they're going to come like this, and then in the medulla oblongata, boom, it's going to cross over. So tell me one thing. When somebody has a stroke, when you have a stroke on, for example, your right upper extremity, where is the lesion in the brain? Do you know that somebody, when they have paralysis on one side, they say, if I have paralysis on my right side of my body, my left side is where I have a stroke. Do you know that? Somebody? Please tell me, please. Tell me, don't
Yeah.
answer. I'm watching each of your eyes. So please, Erwin, Marilyn. So
Yeah.
do you see somebody who are paralyzed? Do you know somebody paralyzed? Or you saw
Yeah.
yeah?
Like,
So if the right side is paralytic, the left side is where it was affected, the opposite. When somebody has paralysis or deficit on the left side, is the right cerebrum where is actually coming the stroke. So the stroke, what is a stroke? That portion of the brain is dead because they blocked by blood circulation. There is no blood circulation. Okay, and then, but I want you to be clear on that. How is that called? Is that crossover or called what?
decussation.
Decussation. Okay, decussation. This decussation is telling you if I have lesions of lack of mobility on my right side, which part of the cerebrum is affected, the right or the left?
The left side.
The left side. If I have problems on the left side, where is the problem? In the right side of my cerebrum. You okay with that?
Yeah.
Okay. So this is very important, okay? Another thing that you need to remember is the medulla oblongata is the cardiovascular respiratory center. So your heart and the lungs stimulus are going to start from the medulla oblongata. You okay with that?
Yep.
Okay, how many cranial nerves you have?
12.
12. Where are coming from?
Brainstem.
Brainstem.
Brainstem. Okay? And how many? We have three main centers in the medulla oblongata. That is the cardio-respiratory center, right? The cardiovascular respiratory center. And what is another thing that we have is the decussation or the crossover. It's at the level of the medulla oblongata. Okay? All right.
Yep.
Okay, so let's talk about the diencephalon and the cerebellum at the end. We are going to, this is very short, but it's very, very important. All right, so let's talk about the diencephalon. Look at that. I want us to observe where is the diencephalon. This is the diencephalon. So what is this? Okay, so I told you that we have the brain is composed by cerebrum, cerebellum, and the brainstem. Okay, so that is the general. If you want to go more detail, you need to know about the diencephalon. All right, so in order to do that, I need to tell you what is the form, how is the cerebrum first. Okay. All right, so we have cerebrum. The cerebrum, we have the cerebral cortex and the subcortex or the cerebral precortex, and we have the limbic system as well. All right, so tell me one thing. If you have this, this is the cerebrum. We have, how many cerebrums we have?
2.
2 cerebrums, okay? And here we have a fissure. It's like a separation between the right and the left hemisphere. So it's called the superior longitudinal fissure. So if you put your finger there in between the 2 cerebrums, you are able to separate them. You're able to separate the right from the left, the right from the left. Okay, so now here we have in this, I'm going to draw, sorry, it's kind of a little bit over everything, but I need to go over. All right, so we have the cerebrum like this. Okay, this is the cerebrum. Tell me, why do we have all these lines like this, like curves? Those are called circumambulations. We don't need to know that name, but if you see here, it's like a spaghetti, right? Look at that. Look at that. It's a bulging area, correct? Yes or no?
Yes.
Why do we have those bulging areas? You will tell me after I explain you this. This one. This is a piece of the cerebrum. Okay, any part of the piece. So all this is going to be like a bulging areas, bulging areas, bulging areas. These bulging areas are going to be called the gyrus. Question for the exam. These bulging areas of the brain called gyrus. Gyri is a plural. Sulcus is the lines here in between, lines in between, lines. This is sulcus in plural, which we call the sulci. Sulci. Okay, so now if you remember, if you see here in this image, you see here this area. See? This area. All this dark structure. And this dark structure is going to be called the cerebral cortex or gray matter. Gray matter. And here below that, we have the white matter. Why? Because it's white, the white matter. All right, so I want just you to imagine an orange. So I'm going to give you a little. So I want you to imagine an orange. The orange, the skin of the orange, okay? We have the pulp of the orange, okay? All right. So the skin of the orange is going to represent the cortex of the cerebrum, cortex. And the pulp of the orange fruit is going to be the white matter. So how many components we have in the brain? We have the cortex and the medulla. So the cortex is the gray matter, and the white and the inner portion of the brain is going to be called the white matter, who is representing the orange. The white matter is the pulp, and the gray matter is the cortex, the skin of the orange. All right, why is that important? We have different type of nerve cells in the gray and the white matter. The gray matter are going to contain cells who are the commanders. Where's my stuff? Okay, I'm going to do it again. So I'm going to do a brain here. It's a brain here. Okay. And here on these borders, all these borders I'm drawing, all the circumambulations, the outer portion is going to be gray matter. Gray matter or cold cortex. Those are nerve cells who are commanders. They are commanders. So those are the who make orders. Those are the ones who say, you need to stand up, you need to study, you need to walk, you need to work, you need to eat, you need to, whatever you need to do is in the cortex of the consciousness, is the cortex of the brain. The pulp, that is the white matter, the rest, the white matter, are going to be basically transmitters, are going to transmit the orders of the gray matter. All right, so look at this. The gray matter are going to contain nerve cells who has all the typical classification that we already know. Dendrites, body, soma, nucleus, axon, terminal axon. That is a gray matter. A white matter cells that are, these nerve cells are located on the pulp of the orange. So we have here a nerve cell, again, we're going to draw a nerve cell with the axon here, terminal axon, and we have the dendrites here, similar as the previous one. But what is the difference? The difference that are going to have other cells. In addition, those are the Schwann cells who are going to be surrounding the axon. So these are the Schwann cells that contain myelin. What is myelin? Myelin is a type of fat. Okay, and what is doing these Schwann cells on the white matter? These are going to accelerate the electrical impulse. Again, so the velocity of the electrical impulse here is going to be about 1 meter per second. Meantime, here we have the Schwann cells in this white matter are going to transmit 100 meters per second. See, it's very fast. It's very fast, very fast. So this is logical because if you're in the army and you make orders, you want that these orders need to be submitted and sent it very fast, correct? And that's why the white matter contains these Schwann cells who are going to accelerate that electrical impulse. You okay with that?
Yes.
Yes. Okay. One of the difference between animals and humans is the intelligence, right? So we know, well, we think that we are more intelligent than most of animals, and so anyhow, another topic. But we are supposed to be the highest level of intelligence in the world, correct? Okay. So if you see, for example, a fish brain, the fish brain is going to be like this. Only like that. A frog are going to be something like this. A human are going to be something like that. A lot of more sulci. So why we have more of these up and downs than the fish and the frog? Why? Because the thinkers, where is coming our consciousness, our intelligence, are coming from that gray matter. Gray matter. Gray matter are the thinkers, right? Are the ones who elaborate and determine what to do, what not to do. So that is the gray matter. Where is the gray matter? In the cortex of the brain. Where is the cortex? In the outer layer of the brain. You okay with that? Now, this why we are going to have this sulci or sulcus like this. Look at that. Look at that. See, up and down, up and down. We have up and down, up and down. So can you see the here? This is a specimen, real specimen. Can you see this dark area?
Yes.
That is the, everybody,
Cerebral cortex.
cerebral cortex. And what is the other name?
Gray matter.
Gray matter. Gray matter. Gray matter. Okay. So and below that we have the white matter. The white matter in between. All right. So now, just to make it not too long, why we need to have all these up and downs, and why we don't have a smooth brain? Why? Because listen to this. If you have a line like this, let me make it a line like that, and then you have another line like this, and then you pull it out. If you pull it, this line will be up to here to here. But if you pull this line, it's going to be up to here, right? So we have these up and downs because we want more surface for gray matter. We have more gray matter than other animals. So that's why we have more of these gyri in the, what is the gyri? This one, gyri.
4.
So we have many more in order to increase the surface area for the gray matter. That is the difference between us and animals. We okay with that?
Yep.
Okay, thank you. And we have cells who have myelin. Myelin. So we call them myelinated nerve cells. Myelinated. And the other one, this is the white matter. And the gray matter is the unmyelinated. No myelin nerve cells. And that is the cortex or gray matter. And these are going to send orders. All of them are going to send orders, and they have fibers. These fibers, look at these fibers coming all the way, fibers, the white matter. And these are the fibers who are going to be the highway, like 101, 280, El Camino Real, etc., 75, whatever you want. So these orders are going to go to different parts of the brain. For example, the occipital, they send orders to the share information with the frontal to the temporal to the parietal. So, or frontal to the brain stem, or temporal to the cerebellum. So all this brain stem, cerebellum, and the cerebrum are interconnected. So you can imagine whatever communication you can imagine that exists in your brain. And that is because when you are, for example, you're listening, somebody is going to hit your car. So you need to run. So you're listening, right? And then you are moving. So the information that you receive from your ears is being processed by the cerebrum, and the cerebrum is going to share information to all lobes. All the lobes are working simultaneously because all the lobes are going to share information. You okay with that? If somebody is going to hit you're in the street, somebody coming over the speed, you need to run, right? You need to run. So how you hear the car coming towards you, somebody is alerting you that the car is going to hit you, and your response is going to be the motor activity. So you're using your temporal lobe and your frontal lobe, and you're using your cerebellum because you balance and equilibrium. And in addition to that, when you are running, your respiratory rate needs to go up because you need more oxygen. As a conclusion about this, all these components, cerebrum, brainstem, and the cerebellum, all of them are working simultaneously. Why? Because they are connected by the white matter. Those are the messengers. You okay with that?
Yeah.
So they work as a unit. They work as a unit. Okay. But one more thing. What about if you know that we have the superior longitudinal fissure that divide the two cerebrums? How come the right cerebrum will share information to the left side, and the left side are going to share information with the right side? Okay, and that is important for the exam. So the answer will be this. If you see here this part, this is a specimen, and this is what we call the corpus callosum. Oh, so I'm going to draw it. Corpus callosum is this. But this is just a cross section. The corpus callosum is not just a line. As you see, corpus callosum is going to be like this. This is towards your forehead. This is towards your occipital area. So the corpus callosum is like this, like a bridge between the right and the left hemisphere. So information from the right pass to the left through the corpus callosum, and information from the left pass to the right through the corpus callosum. We okay with that?
Yes.
That is the image of the corpus callosum. You need to think about a 3D dimension. There is no depth. So, but they go from anterior to posterior. It's like a big bridge that is going to be from the occipital to the frontal lobe. So this bridge, just to you to know how to call that, is going to be called the corpus callosum. Corpus callosum. The corpus callosum is composed by white matter. Okay?
Yeah.
Yeah.
All right, so that is the corpus callosum. Okay, very good. So let's keep moving. And yeah, so here we have a look at that. This is the brain stem. This is the midbrain. This is the pons like O pons, medulla oblongada. And here we have the end of the cranium. This line is the opening of the occipital bone, where it's coming the medulla oblongada and turns into the spinal cord. That opening is called the foramen magnum. Okay, but all this is just to talk about the diencephalon. And talking about diencephalon, we are going to, you want a break or you want to continue?
Can we continue?
Continue, excellent. Okay. So here we have the diencephalon. So for this, I'm going to give you a picture. You have the orange, right? Imagine the orange in your hands. You have the skin of the orange. You already know that is the gray matter. Those cells are the thinkers, are the ones who give the orders, who make decisions. Then go to the pulp. The pulp is going to be white matter. What is the function of the white matter? To transmit the information, to transmit or to carry the orders. Okay? Now, imagine in that orange that we have seeds. The seeds of the orange. The seeds of the orange are located where? In the center of the orange, right? Similar are going to be the diencephalon. Diencephalon will represent the seeds of the orange. I want you to keep that image because it's going to be easy to remember where is the diencephalon. Diencephalon is composed, and write down this please, diencephalon is composed by gray matter, Diencephalon are decomposed by gray matter. So the seeds and the cortex of the skin of the orange are going to be sinkers. Okay? So the seeds means the diencephalon, and the skin of the orange means the cortex of the cerebrum are going to be sinkers, are going to give you the orders, the decisions, make decisions. We okay with that? Okay.
Yeah.
Next. So here we have the diencephalon, as we already mentioned. Those are the seeds of the orange. This diencephalon, please, this is question for the exam, is diencephalon is composed by gray matter. That means that it's an unmyelinated axon. The diencephalon are going to be divided in epithalamus, thalamus, and hypothalamus. So I'm going to mention two of them. The thalamus, or thalamus. We have two thalamus, one on the right, one on the left. One on the right, one on the left. So we have two thalamus. And we have two hypothalamus. Hypothalamus. Why is it called hypothalamus? Because it's below of the thalamus, right? Okay? So we have thalamus here, and below that, under this, you're going to find the hypothalamus. Hypothalamus is one of the very important component. Tell me one thing. Hypothalamus is gray matter or white matter?
Gray matter.
Huh?
Gray matter.
It's gray matter. Aaron, are you okay that it's gray matter or white matter?
Gray matter.
Okay, well, I want to hear your voice. Marilyn, gray matter or white matter?
Gray matter.
Gray matter. So which one we are talking about, Miss O? What is gray matter that we're talking right now?
Hypothalamus.
Hypothalamus, very good. Okay, so the hypothalamus is part of the diencephalon. So where is the hypothalamus? In the diencephalon. So what are the components of the diencephalon? Are the thalamus and hypothalamus. Okay, all right, so these guys are going to be composed by gray matter. Why is important the function of the hypothalamus? Let's see. Okay, I'm going to draw it. I'm going to make a sagittal view, so you're looking from the side. And what happened here, we have the hypothalamus. This is the hypothalamus. And below this hypothalamus, we are going to see, let me see if I have a picture here. No. Okay, so there you are. Here we have, in the center of the cerebrum, here we have, look at the cerebral cortex. With the cerebral cortex is this. All this is the cerebrum. All this is the cerebrum. That is the corpus callosum. That is the bridge. Corpus callosum is the bridge that going to allow the transmission of messages from the right to the left, to the left to the right. Okay. Then we have here, this is going to be the hypothalamus, thalamus here, and the hypothalamus, this area. This is the hypothalamus. Hypothalamus. So the hypothalamus is nervous tissue, yes or no? Yes, correct? Yes or no?
Yes.
So looks like it's obvious, but many people make mistake here. So these hypothalamus are going to be connected, very intimate, with the pituitary gland. Where's the pituitary gland here? Tell me, the pituitary gland is nervous system, yes or no?
Yes.
No, endocrine system, correct?
Exactly. So please read carefully what you said. Very good. So I said pituitary gland. Pituitary gland is this pituitary gland that is so important for many functions of our body. So that is the relation between the central nervous system and the endocrine system. This relationship are going to be called the homeostasis. All right. So, for example, I will tell you. You need to, a kid, they need to grow. Okay? They need to grow. Who knows that? The nervous system. What part of the nervous system? The diencephalon. Who? The hypothalamus. Hypothalamus knows that you need to grow. So what is doing the hypothalamus? Hypothalamus part of the nervous system is going to tell the pituitary gland, okay, pituitary gland, you know we need to grow. And the pituitary gland starts to produce the growth hormone. That is one example. Okay? Then we have, you are lactating. You have a baby and you're going to lactate. Who knows that you need to lactate? Everybody?
Hypothalamus.
Hypothalamus. Hypothalamus knows that you need to produce milk because you are lactating. So what is doing the hypothalamus? Is that, hey, pituitary gland, we need to produce more milk. And the pituitary gland send the order to the mammary gland to produce more milk. You got it? But for example, you need to ovulate. Who knows in your body when you need to ovulate? Who knows? Everybody?
Hypothalamus.
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 Excellent. And the hypothalamus is going to send orders to the pituitary gland to secrete the luteal hormone, the luteiniscent hormone, to produce the ovulation. That is happening with growth, secretion of milk. We are going to see that in the thyroid hormones. What is doing the thyroid hormones, by the way? Do you hear about the thyroid and the metabolism? Do you know
Yes.
that? Yes, all right. So when you are doing more exercises, your metabolism is going up, correct?
Yes.
Yes.
What means metabolism? Is your body is increasing metabolism means more production of energy, more production of ATPs. Yes or no? Correct? If you are doing exercises, who knows that? The pituitary gland, the hypothalamus. Hypothalamus says, hey, pituitary gland, we need more T3 and T4. Okay, so the pituitary gland is going to send an hormone to the thyroid gland to tell them to increase the production of ATPs. Who is doing that? The hypothalamus. If you're stressed, you need to release certain hormones, the adrenocorticotropic hormones. So who knows that? The hypothalamus. So basically, hypothalamus knows everything what happened inside and outside of your body. And this mechanism that is using the hypothalamus is to keep the internal balance of your body. So I want you to write down this. What is the homeostasis? Homeostasis is how the body keep your internal balance. Homeostasis is how the body keep the internal balance. And this balance, this homeostasis are going to be hand by hand between the nervous system and the endocrine system. Who is the nervous system? The hypothalamus. And the endocrine system will be the pituitary gland. Okay?
Got it.
Excellent. All right, so what is homeostasis, everybody? How the body keep the internal balance. For example, we have one hormone that is produced by the pituitary gland. That is a hormone called the antidiuretic hormone. That is a hormone that actually retains fluids in your body. The body is going to produce more antidiuretic hormone to prevent the pee in order to keep the fluid as much possible in your body. And when is that happening? You pee less when you are dehydrated, yes or no?
Yes.
If you are dehydrated, okay, so you're going to, and now you are dehydrated, so you need to retain all the fluids possible in your body. Who knows this?
Hypothalamus.
The hypothalamus. And the hypothalamus is sending all, hey, pituitary gland, you know what? We are dehydrated. We need to keep all the water possible. And the pituitary gland, under the orders of the hypothalamus, is going to secrete what we call the antidiuretic hormone, or ADH. And that is going to retain the fluid. So you pee less. See? So what is the purpose of that? To try to keep the internal balance of your body. And that is called the homeostasis. Given by whom? By the hypothalamus and by the pituitary gland. Okay?
Got it.
Yes.
Okay. All right. So you want the lunch break or you want to continue? Because I want to give you one more thing here, and then we are doing the recaps. All right. So if you don't say anything, I'm going to continue. Or you want a break?
No, good to continue.
Excellent. I like that. Okay. Okay, so now let's go into the recap first, and then I'm going to give you what is really important, what I want you to know in addition. All right, so here we have nervous system, peripheral, and central nervous system. All news, right? Now it's going to be easy. Now, brain division, cerebrum, diencephalon. You already know that the encephalon is gray matter. Cerebrum is composed by gray matter and white matter. The brainstem composed by the midbrain, pons, and medulla oblongata, and the cerebellum. All these are interconnected. Whatever connection you want to imagine, that is going to be interconnected. We have 12 cranial nerves that basically coming from the brain stem. We have 12 cranial nerves happening or arising from the brain stem. The division of the brain stem, as you see here, is going to be the midbrain, the pons, and the medulla oblongata. Here, superiorly, we have the thalamus. The seats of the what? The seat of the orange. There is the hypothalamus here. And here we have the pituitary gland. Okay? All right, so medulla oblongata are going to be control blood pressure and heart rate, cardiovascular control, and respiratory control, respiration control. The diencephalon are going to be the thalamus and the hypothalamus. The hypothalamus is the homeostatic center control. So you can call, I call this the big gossiper. Yeah, hypothalamus is a big gossiper. This big gossiper, the hypothalamus, knows everything that happens inside your body and everything that happens outside of your body. Everything outside. So, for example, you have the pH of your blood, you have levels of potassium, calcium, sodium, whatever. The body is trying to compensate that. What happened from outside? I say outside and inside. So what happened outside your body? Too much hot. It's too much heat. 120 Fahrenheit. So that is, who knows that is too hot? The hypothalamus. So the hypothalamus starts to sending orders directly to for example, to the skin to make sweating. Or they can go through the medulla oblongata to the vascular terms, vascular, because it's cardiovascular, right? And what is doing the cardiovascular? They are going to dilate the vessels when you are too hot. So tell me, why your face get red when it's too hot? Why is that? Because the vessels are going to dilate the vessels under the skin to make it closer to the surface of the skin. So that's why you become red. And why is that? Because in addition, you start to sweat. And when you sweat, the water starts to evaporate. And because the vessels are dilated closer to your skin, the heat is going to go away. It's like you have a pan in your kitchen, after you cook, you put it in the cold water. It's not a lot of smoke coming up, right? The pan is because you put your hand in the smoke, it's hot, because it's taking literally the heat from the pot into the environment. So you are the pot, you are 120 Fahrenheit, and you start to sweat, and the sweat is going to evaporate and take with the evaporation the heat of your body. So how they know that? Because they know what is outside, what is inside. So everything that happens in your body, inside or outside, is known by the hypothalamus. You okay with that?
Yep.
Yes.
Okay. All right. So now, I call the hypothalamus the big gossiper. Only me call it the big gossiper. No, well, I don't see any textbook called the big gossiper. So, about that, I'm going to keep going with it. Big gossiper. Gossiper. Big gossiper. And the pituitary gland is called the master gland. Pituitary gland. Don't get confused. Master gland is not the hypothalamus. So hypothalamus is above the pituitary gland. It's the hand by hand working the nervous system, hypothalamus, with the endocrine system, the pituitary gland or master gland. Question for exam, master gland. So we have here the hypothalamus, we have the cerebellum. Whatever connections you can imagine are going to be simultaneously, real time, right now, are sharing information. This is the area we have here, this opening. All this is the occipital bone. Occipital. On the base of the occipital, you are looking the cranial obvious from below, right? This opening is called the foramen magnum. Foramen magnum. Magnum means in Latin huge. Yeah, it's a big one. Magnum, like a gun, right? Magnum. Foramen magnum. So inside is called the spinal cord is going to have a continuity. So inside, you put your finger in, what the medulla is inside is the medulla oblongata. And what is below that are going to be called the medulla or spinal cord. There you are. This ring is the foramen magnum. This is bone, 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 bone. This is bone, 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 bone. And here we have this opening that we just saw here. And that is the beginning of the spinal cord or medulla. But here, this area, part of the brain stem, is called the medulla oblongata. This area is called the pons, and this area called the the midbrain. Okay. All right, so let's continue with the cerebellum. Cerebellum is the small brain in Latin, and that is going to contain two hemispheres as well. Two hemispheres, the right and left. And they are going to be connected by, let me see here, so we have a picture here. No. Yeah, is that connected by a vermis? What is the vermis? So we have here one cerebellum here, and another cerebellum here, the right and left cerebellum. The vermis is here. Is going to actually what is it's an structure in the middle of the cerebellum, but they are going to work as a bridge, similar as the corpus callosum. So that's why your right cerebellum knows what is doing the left cerebellum, and the left cerebellum they're going to know what is the right cerebellum doing. So this connection between the two cerebellums are going to be the vermis. I should put more pictures here. This is the vermis. Can you see this? This is the vermis. Where is the vermis? The vermis is this area, all this. So that is the connection between the left and the right cerebellum. Okay? What is the function of the cerebellum? Is to coordinate. Balance, equilibrium, coordination are going to be the functions of the cerebellum. You okay with that?
Yes.
Okay. Now, here we are going to talk about the limbic system. Talking about the limbic system, I'm going to draw a brain in the coronal view. Let me see if it's okay. Kind of, okay. All right, I cut in my brain like this, okay, in coronal view. So what I'm going to find here is, here we have, this is the superior sagittal fissures, superior sagittal, or superior longitudinal fissure is the most common way to call, or superior sagittal fissure is the same, but the most common is to mention longitudinal fissure. Okay, so now here we have, you put your finger there, and there is something that is going to stop here. What is this stop? Is going to be one structure that is called the corpus callosum. Corpus callosum. So you put your finger all the way, it's going to be stopped here. Why? Because the corpus callosum is blocking that. So you cannot go all the way down. So then what we have here is the diencephalon. This is the diencephalon with the hypothalamus, right? All right. So you already know that these are the seeds of the diencephalon, and the seeds is composed by gray matter. Side by side, we are going to have two structures that I'm going to just to mention is the basal ganglia. The one who produce dopamine. But more lateral here and that is our purpose right now. This is going to be called the limbic system. The limbic system. So during the limbic system, just remember, in the center we have the encephalon. Then we have the basal ganglia. Okay, you want to know basal ganglia? Basal ganglia will tell you. Basal ganglia is the one who produces dopamine. These basal ganglia, this one, this basal ganglia, are going to, for different reasons, produce low dopamine. And that is going to lead into Parkinson's disease. Parkinson. So that is the basal ganglia. What I want you to remember for this class is in the center, coronal view, we have the diencephalon. Side by side, we have the basal ganglia, and more side by side are going to be the limbic system. You okay with that?
Yep.
Yes.
The limbic system, thank you. Limbic system are going to be localized in the temporal lobe. We have the right and the left. And the division of these are going to be three: the hippocampus, the amygdala, and the RAS. So this is, if you go to this image here, this is a coronal view. But if I make a sagittal view, they're going to be something like that. So this is the limbic system. This limbic system is going to have three components: the hippocampus, is actually for short memory. Okay, this is the lenticular, amygdala. Lenticular is part of the amygdala. This is the amygdala. And that is going to be the RAS, reticular ascending system. Okay? Hippocampus are going to be short memory. Amygdala, emotions. Reticular ascending system, consciousness. Related to the frontal lobe, so they're working together. So you are alert, you are awake. That is the that is the RAS, reticular ascending system, or called RAS. Okay, so how to apply that? There you are. So amygdala, hippocampus, and the reticular activating system. Where are they located? Side by side of the diencephalon basal ganglia. Okay, so side by side. So hippocampus, when you hit your brain, when you have a hit, don't you sometimes you see these cases they lose the memory?
Yes.
Yeah.
Right? So there's loss of memory because most likely the temporal lobe was affected. Until it's going to heal, it's taking for weeks, even months sometimes. So you start to recover your memory. The long-term memory are located in the temporal lobe itself, not in the hippocampus, in the limbic system. This limbic system is the one who is activated during the arousal for intercourse, sexual intercourse. So that is the limbic system. The cerebral cortex, we have the sulcus and the corpus callosum. Sulcus is going to be all these lines here. All these lines, sulcus. All these lines are sulcus. We have here the sulcus here, one sulcus here, sulcus. This is one sulcus. Another sulcus here. Another sulcus here. And that is the corpus callosum here, composed by white matter So we already talked about gyrus here is the bulging area. Sulcus is the line between the bulging areas. Here we have the gray matter composed by unmyelinated nerve cells, and we have the white matter who are myelinated with myelin nerve cells. The frontal lobe primary function I want you to remember is the actually motor area and cognitive response. Parietal sensory area that we talked in the previous class. Occipital visual area. Temporal auditory. Talking about the neurotransmitters, and that is what we are going to talk after the lunch break, okay? We are the last part and we are going to talk about another portion. Okay? Any question?
No.
No.
Okay, so how is the class so far?
Good.
Going good.
Well,
Guys, I'm trying to do an effort because right now I'm with fever. Congested. Can you see my voice? Hear my voice? My voice looks normal? No.
Yeah, you sound.
I feel congested completely. I'm chill. I'm trying just to do my best. Sorry I didn't be so basically colorful, I guess. But I'm trying to do my best. Okay? So I will see you at 12:38. Okay? Listen, the part that is coming, I need you to be so fresh because it's so important. It's about the neurotransmitters that we are going to complete from the previous class. Okay? All right. See you then.
Dr. G,
Yes.
please, can I know my grade?
I already put it.
Is it changed or I think it is the same?
Miss, you need to go to JG. That is official. Go to JG.
Okay.
You know how to go to JG or no?
Yes, I will. GG.
Oh, you have 100%.
Oh my God. Thank you.
But you need to have some
Yeah.
quizzes, 3 quizzes.
Yes.
All right,
Yes,
so we
Dr.
will talk
G.
about it later, okay?
Yeah.
Okay. All right.
Because I put the fault for this quiz, that's why.
Fine. Okay, good. I want you to do
Yeah.
it all the time, okay?
Yes.
Okay, very good. Very good, miss. Oh,
Yeah. Thank you.
see you then.
Okay. Yes. 即係嗱，你嘅開衫嚟有咋？開車標衫啦，開衫嚟，開車標衫啦。咪屌你！開車到你呀嚟，話透露呀，你把咧我如果年紀到六十路呀，即打是年時卡比打。開車到噃နော်，年紀我唔算開車到。阿爸我哋這樣嚟講啊，你得諗乜嘢啊？你食咩？哦，如果咁樣我食嘅話，食嘅 okay ရှုပ်တော့မမြလောက်ကလည်းမတော်တော့ပေါ့နော်အဲ့ဒါငါလေးတလားဒီမနေ့တိုင်းမှာ quiz ရှိရမလားအတန်းကမနေ့ပိုင်းမှာ quiz ရှောင်းငါပြီးခဲ့တဲ့ quiz ကလည်းငါလုံးဝအမှတ်မကောင်းငါမှတ်ပဲရတယ်ဆဲမှတ်ပြီးတာငါမှတ်ပဲ the was ပဲဖြစ်သွားတာတလားအဲ့နဲ့လေငါလေးငါ quiz ကိုတော့ဘာပဲငါတရားလည်းဟောဟောအဲ့ဒီမှာအဲ့လိုစိတ်ထဲမှာဖြစ်တာပေါ့ဟာဒီလားအဲ့ဒါငါလေးအခု quiz ကိုငါလေးလုပ်လိုက်တာမလေးငါလေးဆက်တော့ရရတိုင်းဒီကအဲ့လိုအဲ့ရပြောဟာဒီလားအော် yes yes
Excuse me, at what time we're coming back? Somebody can tell me what time?
It should be now, Dr. J.
Now? 12:35?
I think so.
Okay, so I'm going to bring everyone, all my cats inside. So, Esto es más información. Okay. Okay, so let's get started. Where is everyone? Can you text them? I see they.
Or 1 more minute, Dr. G.
Sure. Okay. Okay, let's get this started. Okay, so this is coming for the exam, okay? Neurotransmitters. All right, so neurotransmitters, as you remember, are formed by proteins. Are proteins. And these neurotransmitters are going to be produced by the nerve cell. That's why it's called neurotransmitters. Neuro is nerve cell. Transmitter, why? Because these proteins are going to send a message to receptors. Just remember, please, what we was talking in the past. All right, so I'm going to go here. Look at that. Here we have a nerve cell. This is nerve cell.
Dr. G, your screen's not shared.
Oh, okay, sorry. Okay, so let's keep going. So here we have a nerve cell, the nucleus, the body, the soma, and the terminal axon. Okay, we know, and the dendrites. Okay, and you know that the neurotransmitters are produced in the nerve cell. These dots I'm drawing here are going to be the neurotransmitters. Neurotransmitters. Now, these neurotransmitters are going to be basically, so somebody having a connection is kind of a noise in the background, please. Here we have the Schwann cells. Here we have the Schwann cells. All right, so the Schwann cells, please, there's a noise in the back. And these neurotransmitters are going to produce an electrical impulse. I cannot do this. Who is making noise? Okay. Okay, so this is the Schwann cells. Schwann cells that contain myelin. All right, so this is going to accelerate the electrical impulse. Electrical impulse. This acceleration is going to be like this. Look at that. Are going to be in this way. It's what we call the saltatory impulse. Okay, so that is going to be basically these Schwann cells are going to accelerate the electrical impulse, and cells who are without myelin, like in the gray matter, right? So they are going to transmit, but they are going to be slow. It's going to be about 1 meter per second. Meantime, here is going to be 100 meters per second, very fast. Obviously, this is what you have, the gray matter here. Those are the thinkers, the ones who make decisions, the commanders. And when they send an order, they want to send it to the white matter, and you want a very fast delivery of your message. So that's why it's the difference between gray matter and the white matter. You okay with that?
Yep.
Okay. Now, I'm going to take my time talking about this because what I'm going to say is very important. Okay, so for this, how electrical impulses are going to be formed. Okay, and actually for this, how their electrical impulses are going to be formed. So for this, I'm going to get rid of this, and then I'm going to do a new graphic, and it's going to be like this. Basically, you know that electricity is coming. For electricity, we need electricity of the nervous system to make everything work. For example, remember the device they put in your abdomen, and without doing any physical effort, the muscles start to contract, right, in the abdomen, right? So this device, what it's doing is sending electrical impulses to the muscles, and the muscles are going to be able to contract. Okay? So now, this electrical impulse are going to be based in the difference of charges between outside and inside of the cell. Those elements or these electrolytes who are going to be playing this role are going to be the sodium, the potassium, the calcium, magnesium, and chloride. Okay, so these electrical impulse are going to be needed for, number one, a skeletal muscle contraction. Number two, a smooth muscle. So when you have electrical impulse, your muscle can move. When you have electrical impulse, peristalsis can happen. Okay? The contraction of the urinary bladder, the contraction of the ureters, the fallopian tubes, all of them, they have a smooth muscle. So for this, you need an electrical impulse. And number three, that is going to be called the nervous system. It's going to affect to the nervous system. The nervous system are going to be the waves of the ocean that we talked in the past. that are going to push the neurotransmitters towards the terminal axon. You okay with that? So electrical impulse is needed for skeletal muscle, smooth muscle, and nervous system. Now, this part is very intense, very important, because you will understand, for example, how we are going to treat hypertension, how we are going to treat heart failure, how we are going to treat arrhythmias, how we are going to treat myasthenia gravis. So many pathologies, and there is many drugs, many electrolyte imbalance are going to be affected. And for this, you're going to start having this layer that is very important. All right, so let's get started. And please, never forget this. Here we have, let's suppose that this is the cell. This is what happened inside the cell. Inside the cell. And everything that is here is going to be outside of the cell. Okay? That is a cell. This is inside, and this is outside. So you're going to have some graphics that you will not understand yet, but I'm going to explain you very simple in the next few moments. Okay, so here is what happened inside. Imagine this is what happened inside the cells of the smooth muscle, cardiac muscle, striate muscle, and the nervous system. Okay, you can put here cardiac muscle as well. Cardiac muscle. Okay, so there is many components that are going to use this. Number one, what happened when this area, this portion, please, this portion, I'm going to do this, this portion is what is happening when the contraction is going to occur. Contraction of the muscle. And here is going to be the relaxation of the muscle. The relaxation of the muscle. What is this like a mountain here? This like a mountain is going to be, number one, is the entry of sodium. Entry of sodium. And this line means that more sodium and more sodium are going to go increasing levels inside the cell. So more sodium, more sodium, more sodium, more sodium, more sodium. And in order to complete the contraction, you need to have the entry of calcium. Sodium, calcium. Who is going to get first? The sodium. Who is going to get second? The calcium. Now, this sodium, calcium, then they go, when the contraction occurs, that's why I put this midline here, all this, the area of the contraction, then it's going to be coming the area of the relaxation. And for this, you're going to, sorry, it's going to come out, the potassium, is going to come out, the chloride, and it's going to come out, the magnesium. All right, so this is what you must remember, please, okay? So this is already, they're going to come out of the cell. Potassium, chloride, and magnesium. What is coming in? Sodium and calcium. Sodium, calcium, potassium, chloro, magnesium. Sodium, calcium. How can give you some examples about this? For example, you have the heart. The heart is going to have a heartbeat. Looped up. Systole, diastole. So contraction, relaxation. Contraction, relaxation. Contraction, relaxation. So in order to happen the contraction of the heart, they need to enter sodium first. And then to complete the contraction are going to enter the calcium. And then the relaxation, the potassium need to come out, chloride come out, and magnesium coming out. When we apply this, I'm going to give you an example just to let you know why it's used for. Your heart is going to be like, I will do some sound different. Boom, 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 boom. That is 60 to 100 beats per minute. So what happens is the heart is going to do like this. Boom, 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 boom. That is what we call tachycardia. Yes or no?
Yes.
right? So there is medications that are going to, basically what they are doing is they can block partially the entry of sodium into the cell. When they block partially the entry of the sodium of the cell, there is no so many contractions as before. So you're going to have, instead to have boom, 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 you start to have boom, 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 less often, right? So that is one. You can use these windows that where it's going to enter calcium, and they are going to block partially another medication. They can actually block the calcium, and the calcium is going to do the same effect. Another medication that is going to make the potassium stay longer here inside the cell, and that is going to make longer the relaxation of the muscle. Those are arrhythmias. These arrhythmias can be controlled by this process. Okay, so now your normal muscle contraction, contract your muscle, your biceps. Okay, so what is doing? You're going to contract your biceps. Sodium, calcium, relaxation, potassium, chloro, magnesium. So in every single fiber of your muscle are going to enter contraction. Sodium, calcium. And then when you relax the muscle, it's coming out potassium, chloride, and magnesium. You okay with that?
Yep.
This is a very important topic. So I want you to really always remember this, because there is many components. For example, if we give sulfate magnesium, it's to prevent seizures in a preeclampsia, in women who are pregnant. So we are going to give magnesium, and that is going to make stay magnesium longer into the cell. So these seizures in pregnancy are going to be controlled by magnesium, for example. Okay, so that is about this graphic. Now, here we have the nervous system. In the nervous system, the contraction is changing name because the cells are not the nervous cells that cannot contract. So they are going to be called the depolarization. Depolarization. And here R and R are going to be the repolarization. Because as you remember, I told you that electrical impulses are going to be transmitted by pulses. Impulse is going to be boom, boom, the electricity of the heart, of the nerve, like this, one after another, but as a pulse. Okay, so and that is what happened with this depolarization. That is the first phase of the activity of the nerve cell. Are going to enter sodium, calcium, and then it's going to be for repolarization. Is the rest stage of the nerve cell are going to be potassium, chloride, and magnesium coming out. One more example. Tell me one thing. When you do a very exhaustive exercise, when you have you sweat a lot, correct? And you see these guys, for example, who are playing tennis 4 or 5 hours, but under intense sun, right? So what happened? They are actually dehydrated, correct? Did you taste your participation, please? Do you taste your sweat? Your sweat, what is the taste?
Salty.
Salty, right? And why is salty? Because you are losing sodium. You are losing sodium, right? And you are losing sodium and potassium as well when you are sweating. So what happened? The tennis player are going to start having cramps. So why? Because there is no enough sodium, because they are losing sodium during the sweat, and the same as potassium. And that's why they eat banana. Do you see that they eat banana?
Yeah.
Why banana? Because banana is rich in potassium to prevent the cramps. Got it?
Yeah.
So all these electrolytes and all these components are going to be, for example, for your brain activity, concentration, thinking, focusing. And all of these, they are going to be based in electrical impulses. So when you are exhausted, you are running 20 miles. Can you study after that? After you after you finish your 20 miles, can you study? Can you focus? The answer is no.
Or
Sorry? Somebody say something? Okay. So, and that is why, because you are losing electrolytes. When you have diarrhea, you are losing electrolytes, sodium, potassium, calcium, magnesium, chloride. When you have a vomiting, you are losing electrolytes. So you feel confused. You feel that you are not alert as a person who is very well hydrated. And that is because the lack of electrolytes, that they are not mobilizing the neurotransmitters that you have in your body, in the nervous system. Is that clear or no, please?
Yep.
Okay.
Yeah.
So let's talk about the neurotransmitters. Epinephrine is called adrenaline. We have another one that is the norepinephrine. So norepinephrine. Or called noradrenaline. Is the same, so you need to be familiar with that. Okay? Epinephrine, adrenaline, norepinephrine, noradrenaline. So what is doing this is stimulate the brain activity, focusing, sense of alertness. So basically the fight or flight. Because you are being in dangerous, you become very alert. Yes or no? Right?
Yes.
And that is because the adrenaline. Dopamine. Dopamine produces the sense of pleasure and reward. So that is actually one of the mechanisms that we can explain why people become addictive to alcohol or addictive to any drug. Because these drugs are able to produce huge amount of dopamine. Just to not go too far. So a person who is a smoker, smoking produces elevation of dopamine. So that's why it's become kind of addictive, smoking. Okay with that? Produce sense of pleasure and reward. Pleasure and reward. Serotonin. Serotonin is actually the mood neurotransmitter. And I explained you about the SSRIs and all that for depression, right? If you are low serotonin, you are depressed. Your high serotonin is going to be, you don't need to have too much, because that is going to lead you in other problems. So I will tell you in a few moments. Produce sense of calm, peace, and happiness. Mood neurotransmitter is the happy neurotransmitter. You okay with that? GABA. GABA is the gamma aminobutyrate is going to suppress, is an inhibitor. So they are going to basically calm you down, relax. Your muscles are going to be more in calm. They are not, for example, if you don't have GABA, you start to shake. You're going to start shaking. So that is what is doing GABA. GABA suppress activity of neurons and slow down action potential. What is action potential? Action potential, this is action potential. Action potential is how the nerve cell produce an electrical impulse. The part of the electrical impulse will be the depolarization and the repolarization. Action potential is the depolarization plus the repolarization. What is action potential in a few words? Is how the nerve produces an electrical impulse. You okay with that?
Yes.
Yeah.
Okay. We have endorphins. Endorphins is an opioid, yes. our body produces naturally an opioid that is going to calm pain almost immediately. So, for example, did somebody break, or you saw somebody breaking their bones, or one bone? Right?
Yes.
Right? So when you broke the bone, in the first second, you just hear a crack, and then the pain is coming. When suppose that the pain should be at the moment of the crack, when you are broken your bone, but that doesn't happen. Why? Because immediately the body in that second are going to produce endorphins, and that is to prevent extreme pains. That is how the body protect your body, protect you with these endorphins caused by pain. Another one I want you to add here is the acetylcholine. Acetylcholine. Acetylcholine is the ACH, right? So we already talked this in the previous class. Acetylcholine or ACH is produced by the parasympathetic nervous system and by the somatic nervous system. You okay with that? So we have 1, 2, 3, 4, 5, 6. Dopamine is going to, when you have all these neurotransmitters down, especially the serotonin, you are getting into depression. When all mostly neurotransmitters are going to be very high, are going to be, especially dopamine, are going to lead into schizophrenia. So that is the pharmacology, and that is going to be the treatment that you will see later on. If you have a schizophrenia, you need to, all your neurotransmitters are high. So what we need to do is to decrease with the treatment the neurotransmitters. If you are depressed, your depression make all your neurotransmitters go down. So they are going to give you medication to increase the levels of some of these neurotransmitters. You okay with that?
Yep.
Now, catecholamines. What are catecholamines? Catecholamines are the adrenaline or epinephrine, right? Plus the noradrenaline. So that is catecholamines. So please don't forget that. Catecholamines are going to be formed, catecholamines are the adrenaline and the noradrenaline. Or you can call the noradrenaline and the epinephrine. Either way. Is that clear? You okay with that?
Yep.
Yeah.
All right, so let's go to, that is all about the nervous system. How was the nervous system? You okay with that? Any question?
Nope, I'm good here.
Okay. All right, so let's make this part of the class. We are going to make it. We are going to make a summary about that, and you will see. I will tell you what do we need to remember, and what are important for our classes. Okay, up to here is everything that we. And then it's coming the pH. No, okay. Okay, we are going to do BMI today. Yeah? Okay, so let's see. All right, so let's make it simple. Look at this. We have a solution. This solution is going to be composed by a solute and plus a solvent. Solute, for example, will be salt. Will be, for example, sugar. Solvent is always water. Water. So this salt and water, put salt in the water, put sugar in the water, all you mix it, and all what you have is the solution. So what is the solution? Solution is the solvent plus solute, or water plus salt, water plus sugar, water plus whatever can be dissolved in water, that is called a solution. Okay with that? All right. So, but these solutions are going to, let me go here just a moment, please. But these solutions, they are going to have some reaction. So what I mean is this, that you have, for example, a substrate A plus okay, so, okay. We already talked that solute is the same, we are going to say that is the same to say subtract. Or is the same to say reactant. Okay? Solvent is going to be just water. Solute, substrate or reactant plus solvent is going to give you a solution. Okay, so if you have, for example, a component A plus a component B, that is going to give you another component C. What one example? Let's do some example. We have A, let's make it the substrate is carbon dioxide. You know, carbon dioxide is coming from the Krebs cycle. And plus B, let's make it like it's water. And what you're going to have as a result is the carbonic acid. Carbonic acid. So if you see two hydrogens, I have two hydrogens. These two is only for the oxygen, it's not for the C. So two oxygens plus one oxygen, three oxygens. And I have one carbon here. One carbon only, one carbon is already balanced. That is going to lead into hydrogens plus bicarbonate. So we have two hydrogens, I have two hydrogens here. We have one carbon, three oxygens, 1, 2, and 3 oxygens. Okay, so this reaction always is going to companion with an enzyme. The enzyme, what it's doing is to accelerate chemical reactions. So you have here carbon dioxide plus water is going to give you carbonic acid, and that is going to be reversible with the hydrogen plus bicarbonate. Bicarbonate, hydrogen, carbonic acid, and this is carbon dioxide, and this is the water. So you can do this experiment at home. When you exhale carbon dioxide. And if you put a glass of water and put a straw and blow through the straw, you will see that the water starts to change color. It's going to be more cloudy. It's because you are forming you're blowing in carbon dioxide, and this carbon dioxide are going to combine with the water and produce these elements. Okay? This hydrogen, I'm going to make it very clear here, hydrogen is very acid. And these bicarbonate are going to be very alkaline. So we will see that in a few moments. Okay, so we are talking about enzymes. Enzymes are proteins that are going to accelerate chemical reaction. Another example that we was talking about the glucose, right? When you feel weak because you need ATPs, you feel hypoglycemic with low levels of glucose in blood, you're going to use sugar. Sugar enters into the cells, into glycolysis, then Krebs cycle. It's very fast. You don't wait until tomorrow to feel better. If you feel weak, you don't take glucose and you feel better tomorrow. Basically, you need to wait a few moments, and that is going to be it. These enzymes are proteins. Where are going to participate these proteins? Remember the beta oxidation, in the formation of pyruvic acid to acetyl-CoA, to glucose to pyruvic acid-CoA enter in the Krebs cycle, and all 12 reactions, all of them, they need an enzyme. So this enzyme is an accelerator of the chemical reaction. Okay? Okay.
Yep.
All right, so here we have enzymes. Enzymes, everything that ends in ase are going to be an enzyme. For example, I have here lipase. Lipase is going to break down the fat. We have the protease. They're going to break down the protein. Enzyme. We have the amylase. Amylase. They're going to break down what? The carbohydrates. Okay? So if you see here, solution is the same to say solvent, that is the water, plus the solutes. Can be reactant or substract. Okay? So here we have the solvents, thank you, solvent, solutes, solid water. That is a solution. Another solutions, we have your tea, your coffee, margarita. Margarita is a solution, no? It's a solution. Another solution, we have here this sodium chloride. This sodium chloride is a concentration of 0.09%. It's called normal saline solution. What is normal saline solution? This is what you put in the IV in the patients, right? When you want to hydrate the patient. Normal saline solution will be water plus salt, and that concentration. We have other ones, they have the dextrose. The dextrose are going to be, what is dextrose? Don't forget that. It's the same to say glucose. Glucose, okay? So what is the solution here? This is a solution. Water and dextrose or glucose. That is the same. You okay with that?
Yep.
Okay. So please, what happened? Everybody, nobody's participating today. What happened? You okay?
Yeah.
Oh, I don't hear you. Oh. Okay. Marilyn, I don't hear you. Mariel, Marcel. And Erin, of course. Erin, I need you to participate too. Okay. Okay. All right, so the dispersion of the salt in the water, that means that the salt is being dissolved. Are going to get apart, right? So reaction. The reaction are going to be two or more substrates, solutes, or reactants that are going to combine and produce a different component. For this, we are going to see a few things here. So in general, if you have here A, substrate A, reactant or solute, plus B, they are going to produce a substance C. For this, you need an enzyme. And how we represent that? Like this. That is the enzyme. The enzyme, what they are doing is to make react faster A and B to produce C. The term, the suffix is going to be ase, lipase, protease, amylase, etc. We have here the enzyme that is coming is a protein, is going to accelerate the chemical reaction, but they are not going to be part of the product. So that's why we write down an arrow here. So it's like this guy is coming to help, and then when the reaction is already accomplished, the enzymes are going to reconfigure themselves and come back to his previous state, looking for another reaction. Nice? You okay with that?
Yep.
Yes.
So
Yeah.
this enzyme, thank you, these enzymes are going to be helping, but do not. It's like you have your car without the gas. You push your car to the gas station, and somebody is coming and pushing your car with you. So you're going to go faster or get faster into the gas station. And when you get into the gas station, the person who's helping you says, "Thank you so much. Oh well, I'll see you next time. Goodbye." So that person is the enzyme. You okay with that? All right. So, so saying that, we are going to see that the proteins, they have a shape. They have a shape. So there is enzymes are going to be specific for certain solutes, substrates, or reactants. Everything, all enzymes are specific as well. Why? Because the proteins are going to have a shape, 3D or 4D shape. And they're going to look for the specific substrate. For example, if this is the enzyme that is a protein, right? So these are the substrate, and they have another substrate here. So which one is going to react with? The one who has the same shape. They are not going to, they are coming here trying to get in, but they are not able to react. So the enzyme will not help to accelerate. Okay? All right. So that is number one. Number two, there is another helper that is actually what we call a coenzyme. So just to make it easy, your car is go to the gas station, you need to push your car, somebody is coming to help you, that is the enzyme. But you know what? There is another one who is coming to help you to push the car harder, and that is the coenzyme. Who is the coenzyme? The coenzyme, the second person who is coming to help you to accelerate the chemical reaction, are going to be the vitamins. So what are vitamins? Vitamins are coenzymes. Coenzymes. So why is coenzyme? Because coenzyme cooperate with the enzyme. Who are those? Are the vitamins. You okay with that?
Yes.
Yes.
Yeah.
But there is another guy who is coming to help. These guys are going to be called cofactors, and that is the last one. There is no more. Cofactors. These cofactors are going to be who? The minerals. Minerals. So minerals are going to come to help the enzyme and to help who is helping for this chemical reaction to occur? Enzymes, vitamins, coenzymes, and the minerals are called cofactors. There are many examples about this. For example, vitamin K. The vitamin K is a vitamin for coagulation. Vitamin K for coagulation. In the liver, we have coagulation factors. These coagulation factors are used to coagulate. For example, you hit your arm like this only. You have already broken vessels. Yeah, like this. You already have broken vessels. And for this, we need to have a coagulation. So how you can explain a person who is doing this and have bruises? Or most probably have lack of vitamin K. Why is doing the vitamin K? The vitamin K is going to have several reactions that produce a product called fibrin. This fibrin is produced by 12 reactions previously in the liver. And this fibrin is going to help to form the clot. So in order not to keep bleeding. So in these reactions, what is going to participate is the vitamin K. In addition, they are going to participate calcium as a cofactor. So there is many examples. So what I want you to remember in this class is that we have solutes, reactants, and they are going to solo reactants, and the other one, what is the name? Solute, reactants, and my God, coming to me. Solute, reactants, help me. Solutes, substrates. Excellent. Substrates. And these are the substrates, solutes, or reactants, and they are going to be helping for enzymes, vitamins, you need to call coenzymes when you're talking about this topic. You're talking, no, you don't say vitamins, you say coenzymes, and minerals. You okay with that?
Yep.
Yes.
Okay. Catalyst. Catalyst is the other name of enzyme. Catalyst mostly we use as when we said, okay, so let's make a catalytic reaction to these two substances. So that means that it's going to involve enzyme. Catalytic means the same as enzyme. Okay, it's going to speed up the reaction. All right, so here's what you need to know for your exam. So this guy, you see like a Pac-Man here. I don't know if you knew Pac-Man. Anyhow, so this is an enzyme. This is the enzyme. Enzyme, 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 enzyme. This is the solute, reactants, or solute, reactants, and the other one, solo, reactants, and subtract. Okay? So they're coming, and look at this. They have the shape. So if you have another substance that is like this shape, they will not match. So the enzyme is not going to be accelerating the chemical reaction for this solute. So they are coming in this place, and they are going to happen all these chemical reactions, and then separate them. See, they are separate. So what you need to remember is this. The enzymes binding site is the location where the substrate attached to the enzyme. What is the enzyme binding? This area. This is the binding site. Binding site. Enzyme active site. Enzyme active site is the surface when they match the substrate with the enzyme and the enzyme with the substrate. So that is the enzymatic active site. Enzyme substrate complex, that is actually the reaction in progress. And then you have this enzymatic conformational change. So if you see here, the shape is going to keep the same. So if you see here, the enzyme will not be part of this substrate or another substrate. It's totally independent. So what they are going to look, these enzymes are going to look for another substrate as this, like this. So in the exam, I'm going to ask you, well, what is an enzyme bind site, enzymes active site, enzyme substrate complex, and that's it. So that is how they are going to be. Sometimes some enzymes are going to be as specific for some substrates. Okay? All right. Is that clear or no, please?
Yes.
Yeah.
It's clear.
Okay. Examples, pyruvic acid, those enzymes, they can be helping in one direction. For example, these enzymes, in the case of glucose and pyruvic acid, they are going to be, the same enzyme are going to be used either way. Glucose to pyruvate or pyruvate to glucose. So some enzymes are going to be reversible. Other enzymes are going to be irreversible, like the pyruvic acid into acetyl-CoA. So that is an irreversible reaction. Okay? Another example of reversible reaction is the beta oxidation. That is turning the fats into acetyl-CoA or acetyl-CoA into fats. Enzymes always are going to end into ACE. Okay? Sucrose hydrolase. For example, we have the disaccharides, and the disaccharides are going to be the lactose, are going to be the maltose. They can be the, what is the other one? Sucrose. O's, right? OSE, those are disaccharides. But it's coming one enzyme called, for example, we are going to see the lactose is coming one enzyme is called the lactase. Can you see the difference? Lactose is the disaccharide, and we apply the lactase, is an enzyme who is going to break down the lactose into galactose and glucose. Same here for the maltose. The maltose, we have an enzyme called the maltase that is going to break down the maltose into glucose and glucose. And the sucrose are going to be the sucrase that is going to break down the sucrose into glucose and fructose. Okay? So we have here sucrose hydrolase. That's another way to call the sucrase. So more easier, I'm not going to ask this, but easily is just to remember these names. Just, I don't like 2 words because it's actually sometimes it's too much space in the mind. So lactase, maltase, and sucrase. Now we have here another helpers. Those are enzymatic helpers, the coenzyme and the cofactors. So we have different vitamins. We have certain vitamins, I guess, A, B, C, D, E, K, right? And the B have vitamin B1, 2, 3, 4, 5, 6, 7, 9, 12, right? So those are the enzymes. So these vitamins, okay, I will tell you very fast. Okay. I guess I'm getting worse. My God. Okay. For example, you know that your skin right now is not the same as a few years ago. How long? 7 years. Every 7 years, your skin is not as it was before. So if you have 27 years old, so 27, so at 20, the skin you have at 20 is not the same as today. Every 7 years, the skin is changing. Okay, so what I'm trying to say is this. Vitamins. Tell me, what happens when you have low levels of vitamins? What happens with your skin?
It ages.
It
ages
ages, yeah. And
through
you see
oxidation.
people, for example, you see these homeless in the street. They have lesions on the skin. They have lesions around the lips, like ulcers and something like that. Right? Yes or no? Yes.
Yeah.
Okay, so what happened is this. Your cells are going to slough off all the time. You don't see it because actually you cannot see it, right? But your skin, all the cells need to be replaced. For example, the cells, the lining of the stomach, all the GI tract, they are being replaced every 3 days. The respiratory lining is replaced every 2 days. The skin is going to be replaced basically every 3 to 4 weeks. But the skin will be completely different after 7 years. So what does it mean, please? If you slough off some cells, those cells, they need to be replaced by a new one. Yes or no? If that cells are not being replaced on time, you start to have some ulcers, some lesions. Your skin become like a homeless, right? Homeless are having low levels of vitamins, right? Right?
Yes.
Okay. So listen, when the cell is lost, they need to be replaced by a new cell. But in order to have a new cell, you need to have cell division, right? The cells who are there, they need to divide to replace the one who is gone. You follow me?
Yep.
Now, these chemical reactions, the cell division, they must have chemical reactions. So all the process of cell is not coming from heaven. Oh yeah, magic. No, it's going to be through a process of chemical reactions, and these chemical reactions are going to result in successful cell division. And guess what? Especially the vitamin B is the one who participates on those chemical reactions. So if you have lack of vitamin B, you cannot have a fast replacement. A slough off the skin, you cannot have a fast replacement. And they are going to have some ulcers, some decontinuation of the skin. And who is going to do that? Vitamin, especially complex B. Complex B, what is complex B? Complex B is equal to, say, vitamin B1, 2, 3, 4, 5, 6, 7, 9, and 12. So if you don't have those vitamins, you cannot have basically helper to accelerate the replace of the old cells. And that is going to produce lesions on your skin. You okay with that?
Yeah.
Yes.
Right? So that is actually the vitamins as a co-enzymes. What are called cofactors? The minerals. All right? You okay with that?
Yep.
Yeah.
Okay, so this is the hard part. All right, so what is the denaturation? Denaturation. Marcel, what is coming to your mind, the word denaturation? Anything?
To make like not usable, like to stop from
You know what?
doing.
You know what? This girl was reading the lecture before. Yes, you was reading the lecture before, right? See, there you are. That's helped a lot. Excellent. Erin, are you there?
Yeah.
Okay. Erin, what is mean denaturation? What do you think is the word only, even if you didn't read it?
Not too sure.
Okay. All right. So denaturation means changes the nature of the structure. It's not the same as before. Denaturation basically is related to proteins. I'm going to give you an example to give you what is denaturation. Okay? For example, tell me, Nan, you like eggs?
Yes.
Yeah, and you know, where is the chicken? The yellow or the white? If the chicken will be growing.
Yellow.
No. I want you to open an egg, and you will see around the yellow, the yolk, there is like a more groomy structure. Do you see that? Like a more thick area? Do you see
Yes.
that? That is the chicken. If the egg will be fertilized, that will be the chicken, not the yolk sac. The yolk is that is full of fat, because the chicken doesn't have placenta, and the chicken, when it's growing, the nutrients are coming from the yolk. So the yolk basically play the roles of the placenta in the chicken. Okay, so fat is the yolk sac. What is the white? The white is a very kind of clear gel, right? And you know what? Write it down. That is have high content of albumin. Albumin. Write it down. Albumin. Albumin. You need me to write it down? Everybody know it?
Yeah.
You look like everybody's afraid of me or what? Erin, please. Marilyn, please. Oh, please. I'm not eating anybody. Okay, so albumin. Albumin is a protein. Okay, so, all right, Marcel? Marcel, now, let's go and fry that egg. Okay? Fry that egg, and the white become white, very white, correct? Tell me,
Yes.
can you turn that cook egg into a gel again?
No.
That is denaturation. So what happened with the albumin that you was frying? With the temperature, the egg start to change the shape. They are going to lose the initial shape of the albumin. And that is going to turn into a different type. It's a protein, but a different appearance. And you cannot return to the gel. So that is denaturized. So let's apply what we are talking about. You have an enzyme. Enzyme is a protein. If you denaturize the enzyme, that enzyme is not going to work ever again. Okay? For example, I will give you an example. You have an enzyme, enzyme, we have 1,000 trillion chemical reactions in the chemical reactions per second. We have 1,500 different type of enzymes every single cell. And these enzymes can be denaturized. They can change their shape, so they're going to be useless. And that's what we want to be careful with. For example, when you have high temperatures, it's like you're frying the egg, basically, yes. So most of the enzymes that are being used for chemical reactions are going to be deficient. They are not going to exist anymore. Because when you change the shape by different factors that we will learn today, they're not going to go back to the previous. So I know if I got my point. You got my point. Yes? No?
Yeah.
Yes.
Yes, it does.
Okay, thank you. All right, so denaturation. What is the denaturation? Irreversible change in the 3D shape of the protein lead to a loss of its physical and chemical properties and loss of the protein's function. In this case, enzyme is a protein. What is the function of this enzyme protein is to accelerate chemical reaction. That is not going to happen. For example, egg white protein, albumin, heat, it turns into white solid. Even if you cooled it down afterwards, it does not return back to its original state. The change was irreversible and permanent. The albumin was denatured by heat. You okay with that?
Yes.
Yes.
Yeah.
Questions for the exam. Are you ready? Extreme pH. Extreme pH. Extreme pH. We are going to talk about pH very soon. pH, for example, something you have at home, Clorox. Clorox, you put your finger, don't do that, okay? But if you put your finger, just 1 minute, your finger is going to disappear. Not disappear, but it's going to be ulcers. It's going to really burn. Acid, sulfuric acid. Put your finger there, the finger is done, right? It's a lot of ulcer because it's going to destroy the cells, right? It's destroying protein. Extreme pH in the blood. Of course, you're not going to put Clorox or sulfuric acid, but there's a range of pH that we are going to learn in a few moments. High temperature. And those are the only two I want you to remember. The rest, high pressures, that is physics. I don't care about that. Physical stress, I don't care about that. High concentration, I don't care about that. Just remember, the denaturation are the only two. If I ask you something else, I give you the point. But I'm not going to do it. So I'm going to you remember the two main causes of denaturation: extreme pH and high temperature. You okay with that?
Yes.
Yes.
Yeah.
Okay, we have temperature, pH scale, and we are going to talk about the pH now. With this, we finish our, no, this is inhibition. I'm not going to go on that. It's not going to be touched today. Okay? All right, so let's talk about the pH. What does it mean, pH? Someone?
If
Uh,
it's more. Oh, go ahead.
No, that's good. Go ahead.
No, go ahead. Go ahead.
I was just gonna say like how acidic the solution is. I don't know.
Very good. Thank you for that. Yes. Power of hydrogens. That's what that means. Actually, the pH. Okay. When you release electrons, those are actually like hot potatoes. Put the hot potato in your hand. Hot potato. You're going to burn, right? So what you're doing is just to pass to another one, right? So what happened here? Everything that donate electrons is acid. For example, you have hydrogen. In the periodic table, they say 1. What does it mean? That you have 1 proton and 1 electron. Yes or no?
Yes.
Yes.
Now, what happened here in the periodic table? So you can gain or lose, right? Let's make it lose in this case. So what they're going to do is to release the electron, right? And what is going to leave is a proton. When you have proton here, that means that there's actually already acid because this hydrogen was losing his electron. This electron is what we call acidity. So you represent hydrogens like this, H plus or H plus 1, whatever you want. So when you have H plus, that means acid. Okay?
Yep.
Yeah.
And the opposite is going to be the bicarbonate.
Base.
Sorry?
Opposite is base.
I didn't hear. Bicarbonate. This bicarbonate, you need to remember the name and the formula. HCO3 negative. So I can write it down in the exam, HCO3 negative or bicarbonate, whatever. So this is the opposite of hydrogen. That is what? That is the alkaline. That is alkaline. So we have two opposites, hydrogens and bicarbonate. We okay with that?
Yep.
Yeah.
Yes.
Okay. So when you have this, when is coming this pH of the blood? The pH of the blood is going to be 735, question for the exam, to 745. The pH scale are going to be from 0 to 14. pH 7 is called neutral. Who is neutral? That is the water. pH 2, that is going to be the gastric acid. pH 6.5, 6 are going to be the urine. pH 12 are going to be the pancreatic juice. And the pancreatic juice is the one who contains bicarbonate. Okay? So everything that is close to 0 is acid. Everything that is close to 14 is alkaline. Some people use base, but in medicine, unless you like chemistry a lot, you can use base. But we use alkaline. It's most commonly used. You okay with that? Okay. So what is the blood? The blood is going to be a combination of hydrogens and, besides other stuff, right? Hydrogens and bicarbonate. Why? Why hydrogens and bicarbonate? Why hydrogens and bicarbonate? So why? Because in the Krebs cycle, you're releasing carbon dioxide. Plus, this carbon dioxide are released into the blood, and the Krebs cycle release water as well. So this is going to have a chemical reaction that is going to end into, okay, I'm going to do the whole thing, into carbonic acid. And this is going to be a reversible, where it's going to have hydrogens plus bicarbonate. Plus bicarbonate. So this hydrogen is a very acid, and this hydrogen is very acid, and bicarbonate is going to be alkaline. So it's a combination of all the Krebs cycle that you have in your body, the Krebs cycle, that are going to release carbon dioxide and water. And that is going to give you the levels of hydrogens and bicarbonate. The combination of these is going to give you a certain pH, that this pH should be between 735 to 745. When you reach 6.9, the patient is dead. When you reach 7.9 pH, your patient is dead. Patient is dead. Okay? So now, if we have here neutral, below 7 is acid, more than 7 is alkaline. So, but the blood is here, 735 to 745. 735 to 745. When you're talking about pH of the blood, you need to be very careful and never forget ever in your life. When you have 735, that is, these areas in the range of alkaline, right? Alkaline, this is alkaline. So now, 745, more than 745 means 746, that is alkalosis. So that means bad, alkalosis, it's bad, alkalosis. But here, 735, if you have 734 and below, that is already considered acid. That is in blood. So just be careful, even though that is still in the alkaline area, anything in blood that is 735, below 735 means 734, 733, that is called an acid. You okay with that?
Yeah.
Yes.
Okay. So now the last thing I want to go over is you're going to read ABGs. ABGs. Somebody's familiar with ABGs, please? Somebody heard about ABGs?
No.
Okay, arterial blood gases. Okay, so these arterial blood gases are going to be related to the components. So there's two systems who are going to regulate the acidity and the alkalinity of the blood. Number one are going to be the lungs, and number two are going to be the kidneys. At this moment, where I know that you are not prepared for a deep lecture about this, but I'm going to give you something that is going to be easy for you to remember. All right, so we have 4 different variations. We have metabolic. When it's metabolic, basically it's related to everything but not the lungs. Okay, metabolic. Metabolic is related to kidneys. Yes, I'm going to put kidneys here. Oh, God. Where are you? Okay. Metabolic. And then we have respiratory problem. Respiratory is everything that is related to the lungs. Gas exchange and all that. And the rest are going to be metabolic. So just remember, any alterations that happen in the lungs, that is basically a respiratory problem. And the rest, blood, kidney, whatever, is going to be metabolic. So we have metabolic alkalosis and metabolic acidosis. Here, the same thing. Respiratory can give you problems of alkalosis or problems with acidosis. So those are the 4 changes that can happen in the body. All right, so metabolic acidosis. For this, you need to check, first of all, when you have the reading, this is a laboratory test, a lab test, you need to check the levels of the pH. And then you're going to check the carbon dioxide. That is basically in your laboratory test. In metabolic alkalosis, the pH is low or high?
High.
Excellent. In metabolic acidosis, how is the pH? Low or high?
Low.
Low. Respiratory alkalosis, is the pH high or low?
Aye.
High. And the respiratory acidosis?
Low.
Low. All right, so no problem with this, right? Metabolic alkalosis are going to be this. Excellent. So now the carbon dioxide. Here is where you're going to get confused, but we are going to jump out of the hole after a few moments. So just follow me, please. So first, your eye need to check the pH. That is number one. You need to decide if this alteration is going to be alkalosis or acidosis. Now you already know that it's alkalosis or acidosis. Now the problem is to know if this is metabolic or respiratory problem. Now, in metabolic alkalosis, the carbon dioxide go up. In metabolic acidosis, the carbon dioxide go down. Respiratory alkalosis, the carbon dioxide go down. And the respiratory acidosis, the carbon dioxide go up. How to do this? This is so confusing, right? So now, look at this. In metabolic, the pH need to be with the CO in the same direction. So if the pH is high and the carbon dioxide is high, they are going to, there's laboratory tests that are telling you it's high. That means that is metabolic. Metabolic, but high pH is metabolic alkalosis. Here in metabolic acidosis, when the pH is low and the carbon dioxide is low, they go in the same direction. So that means that this is metabolic. So, but this low pH means metabolic acidosis. In the respiratory, it's different. Here we're going to do the opposite. When the pH is up, I see that it's alkaline, but my carbon dioxide is low. So it's going on opposite direction. And that means that you have respiratory alkalosis. Still confusing? Yes, I agree. Respiratory acidosis. Acidosis, pH is low, so I need to see what happened with the carbon dioxide. Oh, it's opposite. Oh, so it's respiratory. And that is respiratory acidosis. How to remember this? How to remember this? With the word wrong. 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 Wrong means respiratory. O means opposite. Metabolic, and means equal. Okay? Metabolic alkalosis you have when you are hyperventilating. Oh no, sorry. Metabolic alkalosis is when you are vomiting. Vomit. Huge, big number of vomiting. Metabolic acidosis are going to be infections. Respiratory alkalosis, when you have panic attacks. You hyperventilate. You faint. Panic attack. And respiratory acidosis, we have asthma. So these values, these need to be known. So how you already know? First of all, you need to remember your pH. pH. Then the carbon dioxide. The pH of the blood is going to be 735 to 745. The levels of carbon dioxide is very simple. It's 35 to 45. You just remove the 7. And that are your values of carbon dioxide. So I can give you a high carbon dioxide, or I can give you 50 carbon dioxide. So you already know that it's high. So for that, you need to remember the value. It's very simple. The pH of the blood is 735 to 745. The pH of the carbon dioxide is 35 to 45. So what I need to do first, I need to check what I need to do. Check my pH and my carbon dioxide. Who is first? The pH. The pH make me decide this is alkalosis or acidosis. Then I'm going to need to determine if this is metabolic or is respiratory. And for that, I need to know the arrows. If pH go down, and the carbon dioxide go down, that is metabolic. So metabolic. Or the opposite, when the pH go up and the carbon dioxide go up, that is metabolic. So metabolic, equal both. But when they are opposite, respiratory. You okay with that?
Yep.
Yes.
Yeah.
Okay. So that's all for that. What time is it, please? I have 4 minutes.
Okay.
Yeah.
Let's do the BMI, okay? All right, so what is BMI? BMI is the body mass index. That is where you're going to learn in nutrition. You're going to be your own coach. You're going to coach others to know what is your plan for diet, how to lose weight, how to gain weight, how to maintain the weight. You will learn all of that when I'm going to teach you nutrition, okay? But for this, in order to do those calculations, to know if you are overweight, obese, or you are underweight, or you are healthy, weight is what we desire. This is what we need to basically start the calculation with BMI. For example, if you are overweight, you want to lose weight. So you need to calculate the kilocalories and decrease 500 kilocalories per day, and then divide it in 50, 30, 20%. So that is coming later. But now we are going to categorize each of us where we are. Healthy, underweight, malnourished, overweight, obese, and morbid obese. Of course, you're not going to tell me, but right now for me, I am I'm 25.6, so I'm overweight, but this on the margin. How to calculate this? Somebody's crying here. Okay, so let's do the calculation. Hello, are you there? Hello?
Yes.
Yeah.
All right. So let's go to the formula here. Okay. The formula said kilograms, just to make it more simple, is going to be the weight in kilograms divided by your height in meter square. All right, so that is what we are going to calculate today. All right, so let's suppose, let me see if I have. Let's suppose you have the BMI. The BMI is kilograms over meter square. Okay, this is the height, and this is your weight. All right, let's suppose that you have, let's make it, you are 170 pounds, and you are 5 feet 7 inches. Let's make it 6 inches. So I want to calculate my BMI. So I'm going to change pounds into kilograms first because I want to know kilograms, right? So what I'm going to do, 170 pounds times, I put pounds here because I want to get rid of the pounds. I need kilograms on the top. And I know the equivalence. The equivalence is that 1 kilo is 2.2 pounds. So pounds and pounds goodbye, and 170 divided by 2.2 is 77.2. 77.2 kilograms. Okay? So I already know one. Now I need to change my height in meters squared. So I need to change, first of all, here we have feet. I need to change it to inches. And inches to meters. Okay, centimeters, because you know centimeters. Centimeters. And centimeters to meters. See? All right, so I have 5 feet. 5 feet. I need to change it into inches. 5 feet, I'm going to put feet here, and I'm going to put inches here. And I know that 1 feet is 12 inches. So feet and feet, goodbye. 5 times 12 is 60 inches. Plus, I have 5 feet, 6 inches. So I'm going to make a summation of 6 more inches. That is going to give me 66 inches. Now, I need to change 66 inches into centimeters. Inches go down. Centimeters go up. And I know that 1 inch is 2.54 centimeters. And that is going to be 66 times 2.54. That is going to give me 167.64 centimeters. Then I want to change it into meters. So I'm going to multiply centimeters down and meters up. So I know that 1 meter is 100 centimeters, centimeters and centimeters goodbye, and my result will be 1.67 meters. That is number 2. You okay with that?
Yeah.
Okay. So the kilograms here is going to be, kilograms is going to be, how much? 77.2. Misha, please, go. Misha, please. And the height is going to be 167 meters. Okay? Okay, you follow me? Hello?
Yeah.
Sometimes I want to go to school early. Misha. Okay. All right, so now BMI will be 77.2 kilograms divided by 1.67 meters squared. So that is the same to say 77.2 kilograms divided by 1.67 times 77.2 kilograms. I'm sorry. This is the same to do this. 1.67 times 1.67. meters and meter times meter is meter squared. So you divide this 77.2 two times by 1.67. So for example, I'm going to divide 77.2 divided into 1.67. That is going to give me 46.22 divided by 1.67 again. And that is going to be divided in 1.67. That is giving me 27. So the BMI is 27.6. And that's it. You okay with that? It's confusing or not?
No.
No.
not bad.
Got it.
You guys, you said very good. All right, so tell me, please, Marilyn, how was the class today?
It was good. I was glad you had time to go over the math at the end.
Yeah, okay. Miss Oh,
It's good. Dr. T.
okay.
And when are we going to get review for midterm?
Yeah, tomorrow. If I don't know. I start to feel very bad right now, so I will try to do my best. Okay, but
Yes.
yeah, so far we are. It's going to be review unless I said no. So if I don't send any email, that means that I'm going to still do it. Okay.
I had a quick question.
Oh, at what time we agree, Marcel? At what time we agree?
10 o'clock.
10 o'clock. Okay, Marcel. Marcel, tell me, how was the lecture today?
I think Marilyn had a question first,
Oh,
or she's
Melanie,
trying to.
go ahead. Please.
Yeah, I was just gonna ask on Wednesday, are we gonna have like a quiz number 10 and then the midterm, or just the midterm overall?
Let me see. I don't think we have. Yeah, no, we don't have quiz that day. We have the midterm. The midterm is going to be this class, from class number 1 to this class.
Okay. And then will there be math questions?
No math. There is no math. Okay? Something else?
And any terminology
No, solamente only bioscience.
on Bioscience? Okay.
Okay. Erin, your comment?
No, pretty much the same as other classes, but yeah, I do appreciate going over the math at the end. It's good.
All right, Marcel.
Everything was good today. I like that we're doing the anatomy first before the bioscience.
Yeah. Yeah, that's what we were saying before, right? So it's better than that. Daniel?
Class was good. I really liked the ABG explanation.
You heard about ABG before, right?
Yeah.
Yeah, sure. You know, these cats are going to just cook them because it's actually bothering me all day. What to do with this guy? I love him very much, but how I cannot even punish him. Okay. All right. So thank you so much, and I will see you tomorrow at 10 o'clock. 10 o'clock, right? 10 o'clock, 10:30.
Yeah.
Yes,
10
10 o'clock.
Yeah, I apologize. I feel very congested trying to keep my voice for the night. I need to talk 4 hours, and that is actually a little bit kind of difficult. But thank you for your patience, okay? And I like something here. I want to tell you. I like Marcel to control my time. I love it. Good, Marcel. See?
Okay.
So let's keep doing it, okay? Okay. All right, muchas gracias. Have a good night, everyone. I will see you next time.
Thanks,
See
Dr.
ya.
Feel better.
Thank you.